See, I am Dr. M. Kavimani, anatomy professor. See, today we are going to study about the introduction to the upper limb and pectoral region. See, anatomy is generally we will say it's a very tough subject, but very interesting subject. It is a base for all the surgical related specialties, all the general surgery, cardiac surgery, gastroenteric surgery, ENT surgery, neurosurgery. Everything is the base of the thing is the anatomy. See, we can study the body by the dissection. The skills of the dissection is very, very, very important. It is useful for the future surgical related problems. Now we are going to see about the introduction to upper limb. This limb is made up of a basal segment or girdle. The free part is divided into proximal, middle and distal segment. The girdle attaches the limb to the axis keratin. The distal segment carries the 5 digits. The parts of the upper limb: shoulder region, arm, forearm, hand. So the upper limb divided into shoulder region, arm, forearm and hand. Shoulder region. It contains pectoral or breast region on the front of the chest, then axilla, scapular region. The bones of the shoulder region are the clavicle and scapula. Next part is the arm. It extends from the shoulder to the elbow. Bone of the arm is the humerus. Arm extends from the shoulder to the elbow. Bone of the arm is the humerus bone. Forearm extends from the elbow to the wrist. What are the bones? It contains radius and ulnar bone. Then important muscles we should know about the pectoralis major, pectoralis minor, subclavius, serratus anterior, etc. Arteries: axillary artery, brachial artery, radial artery, ulnar artery. And the nerves is contained brachial plexus. See, some selective muscles only I give an examples. These are the muscles belong to the upper limb. Now we will go for the introduction to the pectoral region. The region lies on the front of the chest. Following features of the pectoral region can be seen. One is clavicle, then jugular notch, sternal angle, epigastric fossa, nipple, midclavicular line, infraclavicular fossa, tip of the coracoid process, deltoid muscle contour, axilla. So these are the things we are seeing in the pectoral region. Cutaneous innervation: the skin of the pectoral region is supplied by branches of the supraclavicular nerve, the ventral rami of the intercostal nerves. The muscles of the pectoral region: pectoralis major, pectoralis minor, subclavius and serratus anterior muscle. Pectoralis major origin. There is a clavicular head, sternocostal head. Clavicular head from the front of the medial third of the clavicle, sternocostal head from the anterior aspect of the sternum and upper 6 costal cartilage insertion, lateral rib of the bicipital groove of the humerus. Action: what is the action? It's the adduction and medial rotation of the arm. flexion of the arm, clavicular portion. Nerve supply, lateral pectoral nerve and medial pectoral nerve. Pectoralis minor origin, third, fourth and fifth ribs near the cartilage. Insertion, medial aspect of coracoid process of the scapula. The action is the depresses point of shoulder. If the scapula is fixed, it elevates the ribs origin. Nerve supply is the medial pectoral nerve and lateral pectoral nerve. Subclavius muscle. Its first origin is the first costal cartilage. Insertion lower surface of the clavicle under the subclavius groove. Action is depress the clavicle and steady this bone during movement of the shoulder girdle. Nerve supply. Nerve to the subclavius from the root of the brachial plexus C5 and C6. Serratus anterior muscle. Origin from the outer surface of the upper 8 ribs. Insertion costal aspect of medial border and inferior angle of scapula. Action. Draw the scapula forward around the thoracic wall and it rotates the scapula. Nerve supply is the long thoracic nerve. Then we should know about the clavifectoral fascia. This fibrous sheath situated deep in the clavicular portion of the pectoralis major muscle. It is extended. Above it is extended with the clavicle. Below is attached with the axillary fascia below. The upper part encloses the subclavius muscle. Inferior part encloses pectoralis minor muscle. Below this muscle, it continues as a suspensory ligament which is attached to the dome of the axillary fascia. This clavifectoral fascia is pierced by lateral pectoral nerve, cephalic vein, thoracoacromial vessels, lymphatics. See, up to this we are seeing the introduction to the upper limb. We are seeing the arm, shoulder region, arm, forearm and hand. And we seen all the bones, clavicle and scapula, humerus and radius ulnar bone and wrist bone and digits, phalanx we have seen. These are the bones part and muscles also we have seen in the upper limb, all the muscles like deltoid, biceps brachii and triceps and extensor forearm, extensor muscles and flexor muscles of the forearm. These are the things under we have seen gently. That is, we have seen flexor retinaculum, extensor retinaculum. Then we have seen superficial arch. These are things under gently we have seen. Then this is the introduction to the upper limb. We will see in the later classes very detailed about everything. Now we are introduction to pectoral region we have seen. The front of the chest region is known as pectoral region. It contains the mammary gland both male and female. The mammary gland we will discuss about in separate details before coming classes. Now we are also seeing what are the muscles in the pectoral region, pectoralis major, pectoralis minor and subclavius, then serratus anterior. These are the things under origin, insertion, nerve supply, action under we are seeing. This in this usually this pectoralis major minor is also known as climbing muscle. This serratus anterior known as boxing muscle. So these are the things under we are seeing. Then in, we are seeing also the fascia is there. That is known as clavifectoral fascia. It is attached with the clavicle and the pectoral region and continues as a suspensory ligament, and it also pierced by the cephalic vein, thoracoacromial vessels, lymphatic and thoracic cutaneous nerves. All this will be pierced by the clavifectoral fascia. So we are seeing the pectoralis region muscles, the action, nerve supply, upright anatomy. Upright anatomy, what is upright? Any parallelity of the nerve can produce the parallelity of the pectoralis major. Any muscle abscess can affect the pectoralis minor and form the inflammation of the muscle. So these are the things, are the important things You can see, you can go and read introduction to the upper limb and introduction to the pectoral region. These are the main things you should concentrate. Now you will understand, I think. Go and read and okay. All the best. Thank you.